when I told her about that and I worked on it, she's like, oh, that just came together. It was shocking. And I always keep that moment in my mind because it was actually too much for her. But the body work wasn't too severe. But it was so much info. She was grieving all the like hard work she was doing to train those abs.
Thank you, Dr. Neel Bulchandani, for sitting with me. And I would love to just hear about you as a person and what you bring to the role on a professional sense. I know you have a lot to offer that a lot of people do not know much about. So from my understanding, but please take it away. You're kind of a floor of the mouth specialist, though whole body within that and outside of that. So yeah, who are you first? Just who are you as a person?
Yeah, that's good. Well, I mean, first of all, it's so cool to be sitting with you and talking with you. So I've enjoyed getting to know you. So when I see like you have such a knowledge of these different, practices that optimize our well-being, plus, called biohacks, but is really like finding expedient ways to healing, especially when the world is an environment that, while it's beautiful, it can have its challenges and stressors. And I started in the field of healing almost 18 years ago. I was a molecular biology major, worked as a chemist. I didn't like any of that. And then my brother, who was younger, 2 kids were just horsing around, jumped on his back, hurt his back, went to an orthopedist. My dad's a cardiologist. So he said, oh yeah, go to the orthopedist. And it was helpful to have like the diagnosis of spondylolisthesis, where his low back had this like subtle fracture, but the treatments weren't really helpful. And he was a young kid in high school, was like, I don't want to get surgery. So he went to a chiropractor that helped him extraordinarily. And I'm like, well, I had no idea what that field is. I had never heard of it. So I went to the same chiropractor and I'm like, kind of skeptical because we grew up in that kind of household to be skeptical of things that were holistic.
Dad's a doctor.
Yeah.
And a cardiologist, no less.
Yeah.
Right?
And he, while very intuitive, he learned ways to like rely on Western medicine. And not that I have anything against it. I think we need the East and the West combined in all kinds of ways. But I think it helped me with asthma like pretty quickly. And the chiropractor had answers that I didn't even know. Like I used to like try to adjust myself and I didn't even know that's what I was doing. So I felt good after the alignment, but it was like the knowledge. I think it's 3 months later, I was enrolled in chiropractic college in Davenport, Iowa, which was 3 hours west of where I grew up in Illinois. And in and of itself, that was an extraordinary experience. And then I graduated and started practicing. That was my next level of education because I learned all these amazing techniques and I mentored under some of the best in the field. But then patients taught me way more. And I started to follow the flow of intuition and listen and like, ooh, that technique. And so I started to merge many fields too. So I can consider myself like way more a hybrid, like a manual therapist, but who merges, because I've studied some aspects of osteopathy, like chiropractic osteopathy, and I have studied like craniosacral therapy, craniosacral fascial therapy. But all those names, it's just like working on all the tissues, the muscles, fascia, bones, organs, and having the whole body come into this nervous system regulation point of view where we can come into this balance. And so I really love just what's at the root of things. If I can be the person who helps that directly, I love to do that. And when it's outside of what I know, or at least what I know to do, I love things like, recommending people to go get, pulse electromagnetic field therapy or sauna, but also just like, I think you need that healing technique. You need to go see the osteopath. You need to go see, whoever it is or whatever it is. So I think just being a resource, it's been a great pleasure and honor.
Sounds like you've collected a lot of different tools, right?
Yeah.
Throughout the different fields. And then to use intuition on top of that. And it sounds like you combine those with some logic as well, out of the box thinking.
Mhm.
Is that
Yeah.
accurate? And then you listen to the patient.
Yeah.
Aren't they what they actually?
It means us, and it's like this is just how it like I'm like I feel like I'm just doing like a standard of like what we would think just would be like let that learning healing um and yeah, I think intuition has been my one of my best teachers, listening to what intuition has to say, getting downloads and like tuning in and like really seeing what people need, but also I being willing to like scrap the intellect because I'm thankful for what I learned, but then I come across things where I'm like, this doesn't fit the model of what I learned, the textbooks.
Yeah.
And we went down the rabbit hole of learning all the nitty gritty, unique resources in chiropractic education and then personal development. Like I was always into that. And then, but this is like my origin story of what really got me into like the floor of the mouth work, which
Yeah, speak more about that.
in and for some people who don't know where that is, like, it's I tell the kids that I see babies to adults, right? But for the kids especially, I'm like, so, we got this fancy area in the body called the floor of the mouth. I'm gonna use technical jargon here. There's the roof of the mouth. Why did we think of houses when we were building our verbiage on the mouth? I don't know, but I'm thankful for it because we had the roof, which is the palate, right? And that's comprised of different bones and soft tissue. And then we have the floor of the mouth, and then we have the tongue, which attaches to the floor of the mouth via the frenulum or frenum. And that is that band of thick connected tissue.
Just gonna.
Yeah, exactly. Point. And if anybody wants to like say like, well, yeah, what about it? And like, if you touch your tongue to the N spot when you say the letter letter N, that's like a myofunctional therapy, kind of practice to activate your tongue. But if you then say, okay, but what about the back of your tongue, and you try to get the whole tongue up to the roof, so you create that sound, and then you keep it up there, and then you open your mouth in a stretch, you got a good stretch, right? And that stretches the frenulum, but it also shows the floor of the mouth. And with you, you can see the elevation of the 𝗲𝗏 muscles. Like they're coming up some, and that's called compensation for a tense frenum. So that's inside the mouth. Yeah, there's the muscles right next to that band of fascia called the frenum. Or the 𝗲𝗏 muscles, but we just call them the floor of the mouth, right? Because that's the floor. It's inside the mouth, but there are connections that go up through like this area into there. So the reason I didn't know to explore that. It's not something that many techniques teach. So the reason I explored it was because it was like 8 years into practice. 9 years ago, we had our first child, and she was born. We had the birth at home, and the midwife, she spotted a tongue tie. And that's when that band of tissue under the tongue, the frenum, is too rigid and there's too much of it. Right. And that happens in utero. But so she had tongue and lip and cheek ties. And we're like, okay, now that's like, well, I didn't know that existed. And she's like, just telling us about it. And then, but pretty soon when, little Serenity, that's our daughter, was, kind of bring her to my wife, Dawn, to get there and to breastfeed. It was not comfortable for my wife. And then as we went on in the next days, it was increasingly uncomfortable. We had a lactation consultant who tried to help out, but pretty quickly it was like, oh, that tongue tie is creating so much of an issue and it's so rigid. And we did do body work. I did things, and we had somebody who was more savvy with that at the time who helped, and it was not changing things, because your belly was filling with air because of an improper lip seal. But pretty quickly, she had a tongue tie release from a really great pediatric dentist in the Bay Area, Dr. Sherbin Yazdi, and it was night and day. I mean, but I needed to do these gentle body work stretches for her mouth and her body for mouth for the next 4 to 6 weeks so that it would prevent that tissue from tensing back at the reattachment, right? And then I found that was standard at that time. The dentist and some body workers were telling me, yep, you got to do that 4 to 6 weeks. I did it, but I started exploring the whole body. And I'm like, why am I finding her esophagus, stomach, kidney? Why are those misaligned?
Yeah.
And when I do the stretches, it's not easy on her. But when I do the kidney and the 𝗙cie valve and just the feet, and it loosens up the floor of the mouth, so I barely need to push on it. I need that because I'm a dad who cares about his daughter.
Yeah.
But also, I just thought there's got to be a better way. So I started to like explore that intuitively, and then I found it was like 3 months later, I was still seeing amazing change. And then other babies I started to see, and then kids, and I looked in the mouth of all the adult patients, and I'm like, oh, I'm seeing this as more of an issue. It's a lot of people that have these issues, not just
How many people?
60%. More than half people have some, like the fancy word is pharyngeal arch formation issues, right? That's like the 4th to 5th week in utero gestation, like 35, weeks before we're born, that these issues, some people don't have a tongue tie, or it's really obvious, and they might have narrow maxilla, narrow arches, really narrow palate, or they might have like tori, bony growths on the jaw or even on the palate. Those all fit into that time. So years of working on people and then getting them ready for tongue tie releases, or in great instances, helping them so much that they eat it, thank God. But, but it was more about, there's so much to this terrain of the floor of the mouth that not only was I finding that it needed to be loose and supple for the tongue to move and for us to breathe properly, because we need to get the tongue up there, and gut function relies on that. But I started to see the whole body free up. I started to see Achilles tendon, like calf muscles loosen, thigh muscles loosen, trapezius, SCMs, shoulder girdles, like really specific areas. So I eventually made this map of 70 areas when you have mouth formation issues, tongue tie, etc., TMJ, that there's 70 bones, muscles, fascia, and organs that would contort and twist and misalign a certain way. And as I charted this map out from all my like data over years, I'm like, 99% of the people have a right kidney that is misaligned when they have a tongue tie.
Oh, wow.
And that,
Why is that?
yes,
What's the connection?
I think fascia is one answer, because fascia is the connective tissue that covers everything.
Yeah.
But those who get into the nuance of this are like, yes, and why though? And but what? I mean, I think the other thing to say, we're all born asymmetrically, right? We are born with a diaphragm that's bigger on the right, a kidney that's a different height than the left kidney. And again, we have a liver and a gallbladder here. We have a pancreas and a spleen on the left. And it's like heart's a little on one, heart a little on one side. So I know that there's a big talk about how can we get more symmetrical, but it's like, well, we can start off,
How can we get homeostasis?
balance and homeostasis. And I would say the tongue tie takes what normally is a pretty like homeostatic system where all our differences in symmetry are okay.
Mm-hmm.
But a tongue tie creates this torsion pattern through the body where fascia, the reason I think one of the reasons is if we like study every organ in embryology, the diaphragm starts in the throat. Oh, wow. So the mouth forms at 4 or 5 weeks. And then at 5 weeks, the diaphragm forms in the throat. And then at 6, 7 weeks, it makes its way to the chest, the thoracic pole. Totally. You see it. Yeah. It's like, and it's 10 weeks, it makes its way into the belly where it now lives for most of us, right? Well, it gets pulled and tense. And so you see on a lot of babies, that diaphragm glues and restricts fascia all the way down, so that often that esophagus and stomach are seated too high to have it descended as well.
And the diaphragm is the main breathing muscle.
Diaphragm is the brain breathing muscle, and it has 2 muscles, like one breathing, one digestion. So like in, you look at the definition of a diaphragm, I was like, what's going on here? And I'm like, oh, The diaphragm has two muscles, one for breathing and the other one is literally preventing reflux.
Right.
A barrier for preventing reflux. That's why babies to adults, that they have reflux and acid reflux and indigestion or ARPR. Sometimes it's like, I used to adjust stomachs all day long.
So many of my patients over the years have, yeah, like as adults I'm talking about.
Adults, yeah. And I started to wonder, why is like, this guy needing his stomach adjusted every week? I don't like that because I'm doing really good work or they're getting other work that's, and then I saw, oh, I missed the fascia in here. So when I started to work on the floor of the mouth and the stomach in conjunction, that released way more and the stomach was able to come into alignment and it was way more sustained. The effects were way more lasting and patients started to feel like, I actually feel like I don't need to keep coming to you. And I'm like, that's my favorite thing.
Yeah.
Is when I don't like being dependent on so much, I love help. We need it. But I also am like, but we were designed to live in homeostasis and to unlock and unwind ourselves. So I was like, I really want that for people. And I experiment on myself with all my bodywork techniques to figure things out too. So I think that's why the kidney has its own story. Of the kidney starts as 3 organs in gestation, and it starts in the pelvis. And then eventually it makes its way up here. And so we start like this, we unfold, and there's this high level of proximity between our mouth and our hip in utero. And as we form, I think there's also a connection there where we don't fully unglue and untether. But I do think like fascia is one part, but I really love talking about the organs because they're so important when they're aligned or not for the parasympathetic nervous system, rest and digest. And so I see so many people where they're like, I just can't rest and digest, or I can't, my jaws are clenched, and I, stress. And I know, I'm like, yeah, those things are real. And I totally believe that's why I love somatic therapy and counseling. But like, what if we can get that thyroid or that kidney in alignment? Not only will the mouth free up, but most people, unless they're coming in because they're referred by like, the tongue-tied release provider, the myofunctional therapist, they're not coming into me because, well, that by now they know I specialize in this, but they just want pain relief and like to feel better. So the mouth isn't the goal, but when I release the kidney or the thyroid and the mouth frees up, it creates this phase shift where not only does the floor of the mouth loosen, the tongue loosens, the palate shifts, the lips and the cheeks loosen, and then the sphenoid, the cranials open up, and then it creates this downstream effect where the body turns into butter, and then things can be reorganized and aligned way more gently and way more permanently. I started to see that with people that were coming in and like, wow, okay, I don't see any info out there about this, and I need to make this map.
Yeah.
Because I need it to navigate with my own people. And I started to like, okay, now I know if somebody comes in with a left piriformis, that's really tense where the right's loose, and then the left hamstring and the left calf muscles snow rigid, but the right one isn't as much, but then the right hip flexors, I'm like, that's the tongue. And that's the floor of the mouth. So it was good to be able to know the map, to use the map to more quickly like get to the root of what was going on. But inevitably I was going to check in the mouth with everybody. And that's how I got to like, okay, when I do this, then that frees up this area in the mouth. And then it creates this change elsewhere. And then there's all these. So I kind of made the floor of the mouth my territory to explore for the last like 9 years. And I feel like it's been so enlightening to know. I look at it as like an aperture or like a window through which we see the body.
Yeah.
And some people are like, I thought you were going to do a lot more in the mouth because you focus on that. I'm like, it's true. But once we see, oh, the mouth has its tension, because some people are used to getting dug into in the jaw muscles, and I believe that's valuable. But I'm like, yeah, but if the jaw muscles are that tight and the floor of the mouth and the tongue has that tension, it's got to be coming from somewhere else. And like, I'm talking about tissues like kidney and all that. But sometimes I'm like, I have muscle test and intuit, and I'm like, actually it's coming from sensory, the light. Or we turn off the light and instantly their fascia would let go, their muscles would relax, their organs would release, and they would come into this state of rest. And so I'm like, oh, so your light sensitivity is actually the real thing we need to help. So I found it wasn't just like I wanted to point out the problems. I'm like, if we work with your sensitivity to light by doing eye movements, but then explore the floor of the mouth, then they would find like their sensory issues would integrate really quickly. And especially for the parents of kids, it's like anything to work quickly is helpful. So I started to see like, oh, this is just a way to see. And then it's called the oral diaphragm also, and it's one of the, so this is the diaphragm of the belly, but we have functional diaphragms, and hands down, your field has been the best teacher of our world about functional diaphragms. So I reference Viola Fryman, who's one of the legendary osteopaths, and she's identified diaphragms. And then I know Bruno Bordoni, who is osteopath and PhD in osteopathy as well, and he's identified more diaphragms. And basically, what is a diaphragm? It's it's a horizontal tissue that regulates the flow of interstitial fluid. Fancy way to say it helps control the flow. Like that's it, or the flow cells, right? So fluidity. And I'm like, oh yeah. So if our belly's stuck and jammed, I often found the floor of the mouth there and working on the diaphragm, they would release together. But then the ankles are other diaphragms, the knees are other diaphragms, and preaching to the choir. But then we have the pelvic floor as another diaphragm, and then we can talk about the mouth as a diaphragm. There's cranial diaphragms. We could just say the word too many times. I often would go and I'll be like, it's a back to. I don't know if you've seen Back to the Future. So that the flux capacitor. I started nicknaming this the flux capacitor of the body, of the oral flux capacitor. So if we can shift this, then we can go back to the past at the embryology of how we formed, make changes that not only influence our today, but actually change how we exist according to our embryology, and then help us in the future. So it's like a back to the future place in our body that it's like an event horizon, like a portal, and we can both see the past and then change things pretty quickly. So it's just non-linear. What I would
Start with.
yeah. And so I think some people are like, but I've had this my whole life. I've had this, and then they're like, but that makes so much sense. So it is validating, but I've also see the look on people's faces where they're like, he's saying that I can't do anything. I'm like, no. Well, we do here. Holistically with manual therapy is going to change things dramatically. Yes, I'm a resource. You may need some other procedures. Sure. However, this is the best place to start, because if we make changes here, we can make the body way more supple and, just plastic and pliable and malleable to handle movement and fluidity and stress. And also it's that the phase shift where I see some of these calf muscles instantly turn into butter, and their Achilles tendons can stretch so easily. And then I'm like, now we can see that wasn't the issue. Because I dug into so many people's calf muscles and hamstrings over the years with deep tissue work. It's not lasting. And then, because it was from here in utero, so many babies are born with tongue tie. They have rigid arms. If they do, they have a reflex and things like that. And then they also have tight hamstrings, inner thigh muscles. So I'm like, they didn't, run up a hill. Why gets that?
Why does that happen? Do you have? I'm sure you have ideas. There is this because there's this part of me where it's like every little child was born perfect. And yet you still want that. So why does that happen?
Well, I do think that, back to there's this deep front line of fascia that goes from tongue to toe. And that's been the explanation of why do we have a tongue tie that creates tight fascia in the calf muscles. But I think the deeper why, or the deeper what, is okay, so yeah, what's going on here? And I think there's a lot of theories on why this happens. And I think there's been a lot of shifts in our time of how many toxins are in the environment, but also how we, we got into the movement of a lot of smoothies juices or less chewing. So
There is enough
exactly. So
to chew that meat in the chewable vegetable.
yeah,
The fiber.
you could say, well, fast-paced lifestyle means that we don't have as much time for our meals and we're not sitting, we're not chewing. So I think it's good to look at those like blue zones too of like proper foods and chewing, and the Weston Price diet is really, and I do think those are helpful resources to bring help when it feels overwhelming. Because it's like, yeah, this is so. I have some colleagues that I love, and they're been in this airway and feeding world, tongue tie and palate expansion. They've been at it. Like I collaborate with some who've been doing this for 50 something years. And that means they've seen the trend, and they've seen not only it become
More and more.
way more of us are spotting this because we're more aware, but it is rising. And so some of them have it's hard for them not to get dismal and think like, oh, we're just headed towards. And I'm like, yeah, but there's so much that's out there. There's so much we have available. Like hope and optimism means so much. And sometimes the answer for people isn't like the body work helps, and I love what I do. But sometimes my biggest thing when I help somebody in the moment with it, it's not the digging in. It's like, like with this person that was on the table a few days ago, and I was like, as I'm sensing into things, it's actually not the cranial in the tugging. This it's stiffening your back that I see something at the age of 3 where you left alone, and then 10 years ago what happened, and it had to do with a relationship that ended. And I'm like, I see a rod in your back in the lumbars. And as soon as we talked about it out loud, her body softened and the floor of her mouth loosened. And it wasn't my body work. It was the acknowledgement of a stress and trauma, and there were other words to explain it, and that led to a weakness in her body, so that when we brought it into the field of awareness and consciousness, where her body's like, yeah, it accepted it. And I see so many instances like that with babies, kids to adults, where sometimes it's actually those things that happened in pain and struggle, trauma, grief, that when identified actually led to tremendous change. So I do think, even though there's a lot to say about how these problems are becoming more common, I think there's also a lot more answers now, because if we can navigate the world of integration like spirit, soul, body, and find out that we have so much available within us, that even though when we've been through a lot, there's a lot of relief. So I really like to work somatically and bring in like expressive arts. And so if I see somebody that I'm like, I think the answer for you is like digging in, I can sense that you need like you're creative, you're a musician, right? And some people are like, how did you know that? I'm like, oh, it's just so obvious. Or maybe with others they told me that. So I'm like, I think if you sing, or if you create that art and you express in a moment and exude, right, it's going to integrate you. And sometimes that's like the biggest breakthrough we have in sessions. I had one patient, oh my gosh, I was just like, I really think if you would do oil-based paint, it's going to help you, because she had massive digestive issues. And I was doing all these things, working on her organs. And I'm like, not patting myself on the back, but I'm like, I'm getting the stuff that I know is nitty gritty nuanced, right? And I'm like, but why is it not working? And she was in such stress. So I had this sense and intuition that if she like did oil-based painting, it would help. Well, she started and she's like, I think it's helping. I don't know. She's really humble. Also, grew up with a lot of gaslighting, so she didn't know how to value herself.
Yeah.
And so she showed me a picture of her art one day, and I'm like, did you just do that? And she's like, yeah. And I'm like, wait, you've never done that before? And she's like, no. And I'm like, that is a gallery. That's for a gallery. But more importantly, I think, was that it brought her body and being into a way that it helped address trauma. Because she told me stuff that she'd grown up with, and I'm like, oh, that's rough. And she'd been to counselors, somatic therapy. I even explored some of like, well, what if this is connected to that? I was like, this emotion connected to that organ, it wasn't working. It was almost too direct. Like, anyways, I think the arts are so helpful. So like her engaging in that and finding out that she actually enjoyed it, and that helped with some of the healing, so her body could integrate. She happened to be a phenomenal artist that you never knew she was. So I was like, wow. I just like love witnessing people become who they are,
That's amazing.
Yeah.
And it's like that, sounds like that passion. You're almost opening the door for people to realize that it's okay for them to follow their passion.
Yeah.
Maybe something they're even good at and enjoy.
Yeah.
Maybe having a North Star, perhaps, orienting somebody towards the North Star.
Yeah.
And then that relaxes the body.
Yeah.
Is that accurate?
Yeah.
And then it makes a manual therapy hold.
Yeah. Yeah.
Really add that fascia, releases that past trauma. I mean, you're talking about trauma. Right? There's that book, The Body Keeps the Score.
Yes.
Say, and there's something else. I don't remember if they talk about it in that book, but it's the way I think of it is your body keeps the score, but only as much as you perceive it. So some people, it's like why some people, a seemingly benign thing can be very traumatic to someone.
Yes.
And the next person, it just blows right by them. They take that on. And so there's a certain amount of perception. And it's just exquisite to me how much someone's perception can change their physiology, turn into butter. And so that woman you were speaking about, to be able to express herself, brings that energetic flow, relaxes them, changes the course of their life, creates the need for not needing so much other types of therapies.
Yeah.
From chiropractic to talk therapy to nutrition, nutrition. There's all of these other tools that probably are big levers for other people.
Yeah.
But for her, Zach, you found that big lever. That's exquisite.
Yeah.
And so you've kind of, who else is this for? Like just from people, because people are going to listen to this and be like, okay, well, what about me? Does this apply to me? So you've mentioned like tight hamstrings and acid reflux or just reflux and yayis, right? Or digestive issues. Maybe for older children or into adulthood. Like what are some of the symptoms? And obviously, okay, brain fog, right?
Yeah.
A lot of people have brain fog. That could be from for so many different reasons.
Yeah.
What if someone were struggling with brain fog from your standpoint, from kind of your niche? What would you be looking at as your type of therapy possibly being of benefit?
Yeah. Yeah. Really relevant. And I think that my mind goes in like multiple, I'm a little foggy with, I'm just kidding. No, I do. Though I think it's like, the brain fog part is really important because, it's kind of like it could be coming from cranial bones being so out of alignment that we can't think clearly. It could be coming from adrenal fatigue or insufficiency, like, that exhaustion. It could be coming from like Lyme disease or, like mold. There's almost too many to mention, but it makes me think of the adrenal part because, who, first of all, because I do look at the whole body and all the bones, muscles, fascia, organs, lymph and glymph, and I look at all that. So some people, when they come in, they're like, I just want to learn about my body. I heard you did this. And I'm like, I love asking people, like, what would you most like to gain out of today? Because they may have written like TNJ, jaw issues, and I've got snorer, and I heard you help with that. And but could you look at my toe?
Got it.
And I'm like, 100%. Like your toe matters so much to me. Bunions and toes that don't move, all gout. We can look at that. But I say like, but what would you? And so even when people come in, and I'm like,
watch out! After this, you're gonna be alert on my toes.
Yeah, but no, Rick, I know we gotta do. Yeah, we gotta do. Oh yeah, I mean, and love helping toes. Just on this trip alone, I've loved working on so many toes. Because the toes matter so much, and if they don't work well, our glute medius doesn't activate, and I create back pain, sciatica. So, but I tell people, like, what would you most like to gain out of today? You wrote that 2 days ago about these other things, and they're like, I say, I just want to learn And I'm like, well, let's go through that journey. And so I narrate and explain what's going on in their bodies as I like categorically explain it. But then I'm like, don't worry, I'm gently working on you as I assess. So we are doing body work. And then after I assess everything, then we'll see where we need to go.
Yeah.
And so that overlay assessment is like what some people get so excited about. Some people are like, I just need relief. I want to hear everything you have to say.
Yeah. Just give me the.
But I also just need the relief. And so I'm like, let's go there. I do think like the brain fog is a big one because some people are like, I don't even know. Yeah, I just it's hard to think. So that's really big. So I often find like cranial misalignments can be a big part of that. But and then it's boggish lymph where we're congested and we can't get out talk. Well, the tongue is a lymph organ and it's a massively important one. So I do think some people who have never had their tongues freed, that starts this lymph release that they've been to like countless lymphatic drainage therapy sessions or rebounding and vibe play and all the things through hot and cold and sauna and cold plunge um and also though like for some people all that stuff can be stressful if they're just doing too much. But the kidney is a big part of this too, because I think a lot of people I've seen come in with like adrenal fatigue, and then the brains are like, oh, and I can't, and they're like, if I take adaptogens like ashwagandha and eleuthero, like that helps me, but I don't know, can I get off of those? And I'm like, hey, those are great herbs. I'm glad they're helping you. But let's see. And so many times I find the kidney out of alignment, and in the
And the adrenals sit on top of the kidney.
yes, in the kidney is called a renal gland, and then the adrenal is there, right above it. And so in the East, these are looked at as one organ.
Oh.
And I feel like it's helpful for my heritage is Indian, but whether it's Chinese or Indian or just looking at things as they are. So I just found when I release kidneys on people, their their adrenal function would increase, even their tests would improve. But more than that, they would feel like, oh, I just feel bright-eyed. I feel like I can think clearly. And so I think that can be a big key.
That's so amazing because so many functionalists and doctors nowadays, it's like we put somebody on 20 supplements, right?
Yeah.
And it's still like such a band-aid approach, right? Ashwagandha, yeah, it is. Beautiful plant, herb, can do so much for so many people, and yet it's still a band-aid approach.
Yeah.
And so you're going so much more to the root
Yeah.
of the issue. Let's adjust what's going on from the beginning right now in this moment, but all going back in time from an embryological aspect. That's what it's about.
The other thing that I get really excited about helping, because I had the same thing, is diastasis, ab separation, right?
Yeah.
I thought moms only learn about, I thought after mom has a baby, right, belly expands, the ab blitz apart, and then I literally the six pack that splits apart. Yeah. And so then we have this like the moms who have given birth and then afterwards, and they like have like where it's like hard for them to like hold their core. They might have like incontinence in the bladder and leakage later on, and so I've done a lot of manual therapy to help that. I'm like, oh, so I love helping that and collaborating with pelvic floor therapists who specialize. And then I started to investigate. And I'm like, oh, actually, there's a research article out of Stanford that says all babies are born with diastasis.
Right.
But they come together and heal by the age of 5.
Yeah.
And I'm like, yeah. But after years of working on this, I'm like, that 80-year-old man, his abs never integrated. And that's why his organs never stay in alignment as much as I'll work on them. And that's why his ribs flare, like all the women whose ribs flare. And that's why when they sit, it's so much work to keep themselves up. And they hunch. And so part of that is the abs have separated and they need help. And it's not only can body work help, but I created this, it's not a created away thing, but it's like, I discovered that by working on the palate with violet light cold laser, I've seen abs integrate magically. Wow. Like instantly with some people, especially when it's developmental, like it's been there from the get-go. Oh, wow. And some people are like, how do I know I have ab separation? And I'm like, well, if you have a lot of like GI problems and in nervous system dysregulation, it's hard. You get so stressed and it's hard. It's like, and in a lot of kids who have neurodivergence where we're seeing that more and more where it's the term being used, but it's more like their bodies don't hold alignment and they're maybe they're not stable or but like I said, men and women can have this and it can be there and they never known it.
Wow.
And yet when they have it worked on or we help it, they're like, oh, I can breathe more easily. My gut function is just better because whenever I see a small intestine and a colon that's out of alignment too much, and when they stand, they're like, instead of being like upright, they're like this, and I'm like, oh, that's because your ribs are flaring forward because your abs are separated, so your organs can't hold. So I work on people standing to align them core oriented to gravity, so the abs can go here, and then work on them side posture because gravity pulls the kidney out of alignment. And it's any combination of those things. So that is like rewiring the brain and nervous system. And I've seen like a 35-year-old woman who never had a baby, but had really significant diastasis. When I told her about that and I worked on it, she's like, oh, that just came together. It was shocking. And I always keep that moment in my mind because it was actually too much for her. But the body work wasn't too severe. But it was so much info. She was grieving all the like hard work she was doing to train those abs. And she also, well, anyways, let's just say that people sometimes find that they have been operating out of a fight, flight, fawn, freeze. Nervous system dysregulation. Sometimes it's because of trauma. Sometimes it's because of stress. And then other times it's because of the abs or the organs or the palate's too narrow. And so I kind of like, all that stuff could be going on. So let's explore it all. But let's see what actually moves the dial to make change to help you find homeostasis, balance, rest, calm. And so it's like, kind of no matter what stage somebody's in and what age they're at, there's always hope and there's always change. So, even though like floor of mouth specialist, I mean, I want people to know that's what I do. So that's the only reason I'm like, I'd like it when people say that, but it's more just like, what airway feeding, even that. I'm kind of like, I love helping the airway feeding fields. And I've created methods and systems that are helping all kinds of providers do more with that. I'm really just looking to find a way to help people catalyze and change. And so I really kind of have said like, it's this somatic transformational work that I'm doing this. And I do like single sessions, like baby comes in, usually we start with an hour and a half, an hour, but you down to a half an hour. Some adults, I like do 2 hours and then I'm like, then they need 3 hours. And so I have 3-hour sessions where we go through everything. And then I have some people I have one chiropractor who is really struggling, and we did 9 hours in one day of restructuring the body. Most people don't need that. But I really had done these, I call them system reset experiences. And it was through working on somebody in this way that I saw so much change. It was his big toe that I helped, but it was his knee, a really bad injury to his knee. And he even worked on by like some of the best people out there. And he's like really skeptical. But after working on his tongue, releasing his fascia connected to his tongue tie, I didn't correct the tongue. I cannot remove a tongue tie, but helped the fascia there. Worked intranasally to open up his nasal passages. Worked on his kidneys, his ab separation. And this guy's like one of the top Spartan athletes in the world.
Really?
Oh, and so he finally, so many people with knee issues and the medial meniscus is going on. It's because their patella is too high, because the quad's too high, because of the tongue. So that was what helped his knees. And his big toe, he's like, I need to mention that because I lost hope on that. That's been so messed up. Well, I worked for like 45 minutes on that 2 separate times. And
You're making me want to know. Everybody.
So it freed up his toe and his knee, and he's like, nothing's ever worked for that. But I did like 3 sessions of 3 hours, so over 3 days. But so I created a system reset experience so that I do 3 sessions, 3 hours each over 2 days. So people come to me in Santa Barbara, or like I might go to the Bay Area to do this, or LA, or maybe now San Diego. But like they'll come. And so over 2 days, we'll do 3 3-hour sessions, and then I'll do 1 hour of movement rewiring, where I help them meditate and tune into their bodies, but also move, and we video it so we teach them how to repattern themselves. I like to do it at the beach in Santa Barbara so that we get that grounding in there. 1 hour movement at the beach. And we bookend that with like a pre-consult Zoom and a post-consult Zoom so that I can really give you a map like for how you can go further with this. I've seen some people like regain smell when they've not been able to smell for 18 years. But like, boy, how do we figure that out? I had no idea. It involved violet light therapy in the ear while working intraorally and shifting the cranial bones. And so I have people coming in for that now, like from flying in for this experience. And there's some other things we do like sound and light therapy, but it's that chrysalis phase, like a caterpillar turns into a butterfly, where in this condensed period of time, I love to see how much change we can make, especially when somebody's been struggling with something for so long. So, really like emphasizing that part of my work right now because but the babies don't meet that. Right. And the moms who have babies with tongue tie or they can't feed well, they're colicky, they're, gassy, they're hypersensitive gag reflex, or even there's adults who have hypersensitive gag reflexes. For the mouth flow that I created addresses that. In a lot of cases, we can get rid of that hypersensitivity in a matter of a few sessions so people can swallow when it's been there, or like they can't swallow supplements because it gags them. So we work on that. So not everybody needs this, but I find,
let's be real, everybody needs it.
yeah,
At a certain point, does somebody want to? Does someone make that choice?
yeah.
Right. So everybody needs it.
I think that's a way to say it.
Not everybody needs it, right? Because everything's a balancing.
Everything is a balance. Yeah. And what do you prioritize? Like, what exactly? So I think
So many things.
it's like, what do we need? And what, but yeah. So I think it's like, so a baby doesn't need the system reset experience because we don't want to, but some adults are like, can I handle 3 hours over 3 sessions? Or I'm like, oh, but the assessment and then the body work is gentle because we find our way in with that phase shift. And we might do light therapy, we might do movement. So it's really like my biggest goal is like
It's really
integrative
and just holistic, meaning really broad view. You're not trying to cut down to the chase in 1 hour or 30 minutes.
Yeah.
You're really stepping back and really getting all the pieces of everything they can have to offer. And then going in deeper here and pinpointing the biggest letters.
Yeah.
That's awesome. And so you mentioned that kind of 3 session, 2-day reset. How else? How about virtual?
Yeah, an option, definitely. Yeah, absolutely. I do virtuals, consults, and
When do you give people exercises to do or mouth exercises? How does a virtual potentially help some?
yeah. I do have a course called Tongue Press where people can get it. It's really easy, and they follow this like self-guided class of like audio and video. But the customized personal virtual sessions are I visually analyze, take into account history. Then what I'll do is I'll usually say, okay, now, people know that they'll have gloves or washing hands. I'll have them assess themselves and I'll use my like analysis of what they're doing. I'm like, oh yeah, so I can see that. I wonder about how's that feel. And we look at movement and then I say, okay. And then I work empathically as well. Like I usually can feel what people feel. So I use that ability to see like, okay, your right kidney, I wonder if that's misaligned. Can you squeeze there, squeeze there? Like, oh yeah, it's really tight there and not there. Can you do that? And I teach them how to unlock the kidney and we see the change in the mouth. And then that might be for a case where they're dealing with like a tongue tension, TMJ. But some people are like, I don't know if I have any of that going on, but I just know that I have like my intestines, like I have constipation or like my nervous system's out of whack or I just need so I'm like, okay, let's explore that. And then I'll say like, let's just have you do this movement. So I do a lot of like, is them working on themselves, eliciting change and seeing what happens. And usually it's right there. We can see if we're on the right track or not.
Yeah.
And then I'll give them recommendations on what they can do based on what we find. And then if it's like a parent, I to show them how to work on their beta kids. And so it's really fun to see like what can happen within usually an hour. So we have time to look, assess, And following up is really good too, but it's really good just to see sometimes, yeah, somebody's in Canada, and they're like, oh, I can't get to you. And I seen like the thyroid release to where her jaw relaxed and she felt, I can breathe. And I haven't been able to take a deep breath in a long time.
So you're really teaching people to fish.
Yeah, ourselves. I like that. Yes, definitely.
Sweet.
Yeah. Yeah, and I always, personally, I like that. And I'm like, yeah, I just want to know how can I, and it's what people say, like, okay, I love this, but how can I keep this up? I'm like, I totally hear you. Let me break it down. That one thing we did, it made so much change. I'm going to teach you that. And then this thing, just in case, so they can work on this like as a daily, or at least the semi-regular like frequency to make change. So, because I don't want people to bet, like we were talking about, the fishing bit is such a good analogy. I'm like, rather teach people how to like fish and acquire and pursue for their own sense of agency and empowerment, but also they can't get to me every day, and they might not be in a place to do that. So yeah, how can you do this so you can actually like find ways to self-sustain?
Yeah. Beautiful. I have a question about sleep, but with so many of my patients who issues, I'm talking about more like snoring or sleep apnea. Is that how often are the techniques you're talking about able to at least help that to some extent?
Yeah. We do, in one way, the people that look out for my work, that is one of the number one reasons they do, is because of this connection with like sometimes the soft palate is too weak and those muscles are too weak, or the tongue is not moving well, or palate's too narrow, or I have nasal passages that are blocked. And sleep apnea is like, yeah, it's becoming more common, and we're more aware. And some of the collaborative work that I've done with some of the clinicians out of Stanford, like they are like forerunning sleep and airway center, and we're all finding something that is this a multifactorial issue that it can be helped like so tremendously by simple practices sometimes, like what we're talking about with the floor of the mouth work and tongue press, my course, and then I would say that the way I think about the mouth is that it's not just loosening something, because I think that's the way I thought it was for a while. If it's tight and I loosen it, it's going to get looser and that equals better. And I'm like, actually, those people with hypermobility, right, whether it's Ehlers-Danlos or something else, they're unstable and too loose. And there's a specific place in the floor of the mouth where I see it's like a valley. They don't need looser fascia there. So I actually saw when I do the work on the body, and I have 4 main areas in the body that I find are related to the floor of the mouth, that's like a summing up of the 70 areas, like the head, the throat, the sides, and the feet. But there's a lot more to each of those. But if I find that pattern in the syntax and the order, and then I see the change in the mouth, it actually strengthens weak muscles in the floor of the mouth, and it actually strengthens the soft palate, so where it can help with snoring. So I think it's really good as a place to start.
It's about being able to have the right amount of tension at the right moment in time.
Yeah.
Right? My bicep, I don't want it to be tense all the time. Yeah. I want it to be buttery and relaxed. But then when I want to pick something up, I need it to tense up.
Yeah.
Right?
One of the most, I think, things that has been on my mind a lot, because I've seen this certain, out of like, let's say 60% of people who have, like sleep apnea and snoring, it's like they're in that 60% of people that have these malformation issues, you feel? Out of those 60% of people that are dealing with this, and it's probably on the rise too, I see at least like a quarter of those people that have thyroid gland misalignments that makes the jaw recessed and retrognathic, blocking the airway, and a huge cause of apnea. So they sometimes had been to the best providers in the world, or at least in the region, tongue tie release, palate expansion, orthodontics, jaw surgery, whatever, you name it, or may have it. And I'm like, that thyroid has been blocking the hyoid bone, the throat bone, which is responsible for chewing, swallowing, speech, but also here. And so that's been locking up the mandible. They can't get air, then it creates this pattern of disruption into the brain. So I think some people had this question of like, okay, well, we can do things about certain kinds of sleep apnea, but we can't do certain things about other, basically like central apnea versus stomach. And I think it's actually like powerful to see what the brain can do when you take away restrictions, right? Preaching to the choir on that too, because of what you know. It's like when we can free up the thyroid gland, and it's a simple thing. If we just go like this and like that, some people might feel like it doesn't move at all on one side. Maybe it's your trachea, your windpipe, maybe it's your parathyroid gland, but if it's your thyroid or anything around that, that could be what's locking your jaw. Because I've seen people with retronizing mandibles that have been through all the procedures, and all we do is free up the thyroid, and it's this mandibular glide that happens. Whew. And all of a sudden they can open their mouths and breathe more easily, and that could be
So inspiring.
so. I feel like when teaching a series soon that I call the cosmic mandible, which is the jaw, and the magic that happens when the stars align, and when these planets in the throat can get into the right orbit, the organs and everything. So I do think like and then I would say, like, for some people, my body work could be the answer, or body work overall, or any of these procedures. But then there's things like this company that I'm like really doing a lot of collaborative work with called Sound Health, where they have this headband wearable called Spatial, and it measures the airway, and it sends vibroacoustic frequencies to the measurements like a cone beam X-ray would assess. This assesses that, and we can send frequencies and vibrations into these places to help create some change in some of these structures that are also congesting the airway, that open up and sleep can happen more easily. So I am so thankful for technology that does what sometimes we just need more help doing. But I think these go hand in hand. Like we need somebody, and that's what I've like poured my kind of last 5 years into, is investigating this terrain of the floor of the mouth and how it connects to the whole body. So, because like, you know, sleep is so vital, and people are like, I just don't know why I can't sleep well. I don't know why I have apnea. I don't know why. And I'm like, I didn't have issues. And like, it might have been a trigger. Like, it might have been that mold or that, heavy metal or that stress in your life, that trauma. So let's toggle those levers, like you call them. Let's address those levers. And if we remove those and you are much better, amazing. That's it.
Yeah.
And then also, maybe we do need to free up the floor of the mouth and then direct you where you need to go after that. So I think it's really like I really just loved like I don't know, like the palette of a painter, of an artist, and like I'm like, yeah, we were made amazingly. Which colors do we need? And I think that exploration process of like intuition, the struggles my daughter went through in my life, and like curiosity and just staying like present, tuning in so that we can see what do people need, and how can I stay tuned and attuned to that so that I don't miss something that it happens in that little small whisper, or sometimes when I'm stuck with a case and I'm like, well, I'm testing everything and I'm not sure what to do. I listen, and I'll stop though, and I'll intentionally not do anything. I'll say, people are used to me closing my eyes, and I'm like, I'm just gonna sense for a second where I'm supposed to go here, and then I'll look outside, and I think nature holds clues for us all the time. And all of a sudden, I'll see that tree, and I'm like, why am I looking right at that tree? Oh, that looks like the humerus, the arm, and it looks like that part of the humerus is not moving at all. So I'll check, and I'm like, oh, that shoulder is not moving at all. Right there, I'll free that up, and all of a sudden that'll loosen their mouth. And I'm like, I couldn't have figured that one out. So just tuning in and sit like all the clues are available around us if we just let go of our knowledge for a second and tune into the wisdom of the ages. So I feel like for me, I'm never going to know everything. Nobody is. And so we have a repository of great wealth of knowledge around us. And if we can I love that.
Wow.
I just get
Ah, thank
like,
you.
It's just such a pleasure to like witness creation and nature and see it dance like those leaves out there and be like, wow, if I could just do that all day, I would love to.
Yeah,
So
that's true healer. That's what I would say to that.
what did you say?
True healer.
True healer.
Yeah. Well, all right. Really quickly, good or bad orthotics for the feet?
They can be amazing. Some people owe their health to those. Love that. And then I also know the people who it served them, and then we can re-architect their feet and their base and their body to where they can be without them and be great. So I think both of those.
Awesome.
Yeah.
Orthodontic work, braces, good or bad?
So thank God for orthodontics. Thank God for palate expansion. Thank God for these things because they give like restoration to the aesthetics and the alignment. We know like a bite matters so much for the jaw, the head, the face, grip strength.
Yeah.
When we don't have good bites, grip strength weakens tremendously. And even though people might not care about how strong you can grip, if you're not a mountain climber or a rock climber, you might care about how you grab the steering wheel and how when you're in an accident, if you can't grab it well, it comes up. So I think our bite matters so much. So thank God for the orthodontics and the braces. And then I would say some people, you may have needed braces because of your tongue tie.
Right.
You may have needed braces because of that. So at some point, some people say, I wish I would have known about that before. The good thing is it's never too late.
Right.
So I think it's, so good. We've gone so far to help in that. So it can help so much.
Nice. And grip strength is one of the best indicators for longevity as well. Yeah, so kind of interesting.
Yes.
And yet I doubt very many biohackers and longevity specialists are thinking about grip strength.
Yeah. Well, there's a few, because like, and this the ones that like I'm say Amy Albright, we talked about that.
Connected to it with us.
𝗙𝗏𝗏, I hate Amy for that connection. There's a few others who do, but it's very, you're right. It's not known much, and even those who do know it, they might think, well, the jaw and the bite, but I'm like so excited to unveil.
Yeah.
Then the big toe on your big left toe could be the reason your jaw will close well, and that could be your grip strength.
I'm so excited about this conversation because, with my training, I actually know this, and yet I don't think about it nearly enough.
Yes.
So it's just so good to speak with you, to interact and learn. Learning is what life is about. It's what I love. Where can people find you? And you named what services, what they might do with you, but where can people find you?
Yeah. Oh, thank you. No, I feel so kindred. First of all, resonant with you and like this conversation and just like your nature, kindness and the care that you exude. So that's a pleasure to like talk with you. And then, your field, I am so kindred with osteopathy that I feel like when we talk about embryology and how we form, I know very few fields like osteopathy that understands it that well. So I owe my knowledge of that from osteopaths that I've learned directly or indirectly from, and craniosacral therapists. And, I feel like that is so good. So I feel so resonant and kindred with osteopathy and I would say people can find me. So I am on Instagram, on Facebook at Dr. Neel Bulchandani. It's just DrNeel, and then it's a mouthful, BULCHANDANI. But if you like punch in an NEEL and then floor of a mouth, you'll find me. That's so neelbulchandani.com. You can my website and all that, and then but also that's you can find all my resources there, and even how like reach out to me and just be like, I just anybody listening to this though, you could just look me up and send me a message. It's all up there. And then where I'm at, I think I mentioned this, but I'm in Santa Barbara. That's where I live, and that's where I see people in person there 2 days a week. I'm also in Sherman Oaks in LA 1 day a week, in Agora Hills 1 day a week. I go up to the Bay Area, San Francisco Bay Area once a month. Here in San Diego, and I'm like, maybe I'll have to make more trips here.
Yeah.
And yeah, but people like, because I think I mentioned people are like, there's people coming in from like Salt Lake City soon, or somebody from Vegas, and so some people that are like, we just want to come and see, like they're coming in from different places, so any of those places we could work out. Like people want to come and they want to explore any of this, but reach out because I'm happy to answer questions. Like so shoot me a direct message on Facebook or Instagram. You'll find my info and you'll get hold of me.
Amazing. And thank you for being a pioneer. Because you're taking these fields and then expanding on them, right? It's like osteopathy, fantastic field.
Yeah.
And yet it only is what it is at this moment in time. And so to take that and add your flavors and your wisdom to that is that's a healing pioneer, right, Mir? So thank you
Well,
so much.
you are so welcome. Thank you for this conversation, and I really appreciate it. Well, since when?